Hello everyone, welcome back and thank you for tuning into my channel. Today I'm tackling a fascinating question. Are cognitive performance supplements a brain boost or just a bust? Spoiler alert, there are no universal benefits across all groups. That's because research on supplementation for cognitive performance is complex. One of the main challenges with supplementation studies is that they can be difficult to interpret. Different cognitive domains are measured and outcomes can vary significantly across different population groups. Think healthy young adults, middle-aged populations, the elderly, those with brain injuries, and individuals with neurodegenerative diseases or psychiatric conditions. So what you'll find in this discussion today are specific potential benefits found in human studies that will require larger clinical trials with standardized measurements of cognitive performance. Let's break down the different areas of cognitive performance that these supplements might target. Number 1, attention and concentration. This is assessed through tasks that measure the ability to focus and maintain attention over time. Number 2, memory. Evaluated using various memory tests including short-term, long-term, verbal, and visual memory assessments. Number 3, executive functioning, measured through planning and problem-solving tasks. Number 4, language skills, assessed through tests that evaluate verbal fluency, naming, and comprehension. Number 5, visuospatial skills, use tasks that assess the ability to manipulate visual information. Number 6, processing speed, measured through tasks that evaluate how quickly information is processed. Number 7, social recognition, assessed through understanding the social interactions and emotions. Now let's explore some of the specific supplements that have undergone human clinical trials and their potential effects on cognitive performance. Number 1, creatine. Creatine is well known for enhancing exercise performance, particularly for muscle power. If you want to learn more about why this is important during perimenopause, watch this video. Studies examining effects of creatine on cognitive performance have shown mixed results. A 2023 systematic review found that creatine improved memory in older adults aged 60 to 70, but the results were inconsistent. Small studies of less than 50 participants given creatine for 1 to 7 days indicate that creatine may help brain oxygenation and reduce fatigue in sleep-deprived individuals and children with traumatic brain injuries. Additionally, one randomized clinical trial found creatine reduced depressive symptoms in patients taking SSRIs over an 8-week period. Number 2, B vitamins. B vitamins, particularly folate, have shown promise in reducing cognitive decline and dementia risk. A meta-analysis suggests that higher folate intake is associated with a lower rate of cognitive decline in non-dementia populations, especially with long-term supplementation exceeding 12 months. Lower homocysteine levels measured in blood is linked to adequate B vitamin status and has been associated with a reduced risk of cognitive decline. However, results may vary based on socioeconomic status and the specific types of dementia. Number 3 is omega-3 fatty acids. A systematic review of 24 randomized controlled trials indicated that omega-3 polyunsaturated fatty acids positively impact executive function, especially within the first 12 months of supplementation. The most significant benefits were noted in individuals consuming over 500 milligrams of omega-3 daily, especially in individuals with red cell DHA plus EPA levels greater than 4%. However, variations in study design and cognitive assessment tools suggest that further research is needed to clarify effects on other cognitive domains. Number 4, anthocyanins. Anthocyanins are responsible for the colors red, purple, and blue that are found in fruits and vegetables. A systematic review looked at supplementation in healthy middle-aged and older adults across 13 RCTs to assess outcomes on memory, processing speed, attention, executive function, and psychomotor performance. The primary finding revealed a statistically significant moderate improvement in processing speed among older adults following supplementation. However, no significant improvements were observed across the remaining cognitive domains. There are limitations to the study in terms of publication bias, and there is variability in anthocyanin types and doses. There is a need for future research with larger, more homogeneous samples, standardized protocols, and longer follow-up durations to confirm these findings and unravel the underlying mechanisms. So what about foods that are high in anthocyanins? It's commonly found in blueberries, blackberries, purple yams, red cabbage, plums, and beets. So this brings us to number 5, blueberries. Blueberries are rich in flavonoids and anthocyanins and may enhance memory and attention. A systematic review of 11 RCTs suggests that daily blueberry supplementation could improve both short-term and long-term memory, particularly in older adults without cognitive impairment. However, studies show mixed results regarding attention and focus improvement. The most common supplementation protocol used in research is 25 grams of blueberry powder from freeze-dried blueberries, which is equivalent to approximately 1 cup of fresh blueberries taken daily. On average, 100 grams of fresh blueberries contain 200 milligrams of anthocyanins. It's possible for the anthocyanin content of the supplements to significantly differ because the growing, processing, and storage conditions of the blueberries used to make the product. Number 6. Vitamin D. A 2024 systematic review and meta-analysis investigated effects of vitamin C supplementation on cognitive function in over 7,500 adults from 24 RCTs. The meta-analysis revealed a small but statistically significant positive effect of vitamin D supplementation on global cognitive function, but no significant effects were found for specific cognitive domains. The result shows stronger positive effects in vulnerable populations. For example, those with mild cognitive impairment, dementia, other neuropsychiatric conditions, and individuals with baseline vitamin D deficiency. The effect size was larger for individuals taking vitamin D doses of less than 4,000 IU per day. While the findings suggest a benefit, the small effect size warrants caution in interpreting results. Further research is needed to clarify the optimal dosage, duration, and target populations for vitamin D supplementation to improve cognitive outcomes. Number 7. Resveratrol. A 2018 systematic review and meta-analysis investigated the effects of resveratrol supplementation on cognitive performance and mood in adults. 10 RCTs encompassing over 300 participants, healthy and clinical populations were included. Resveratrol doses range from 75 mg to 500 mg, administered for durations up to 26 weeks. Cognitive assessments varied widely across studies, hindering direct comparison. The study revealed a significant positive effect of resveratrol on delayed recognition memory and negative mood. The effect size were low and the overall findings were inconsistent. This highlighted the need for larger, more homogeneous RCTs to definitively establish the impact of resveratrol supplementation on cognitive function and mood. Number 8. Bacopa monnieri. Bacopa is often touted for its cognitive-enhancing effects, particularly for memory. A 2021 meta-analysis found no clinically meaningful differences in cognitive outcomes compared to placebo, suggesting that any benefits might be small and inconsistent. While some trials indicated slight improvements in working memory, the overall evidence remains low quality, warranting further research into its long-term effects. Number 9. Ginkgo biloba. Ginkgo is often used to enhance cognitive function. While short-term trials have shown mixed results for memory improvement in healthy adults, longer-term trials in older adults with mild cognitive impairment suggest that ginkgo may benefit cognitive function. Taking 2 daily doses of 120 mg of ginkgo extract is the most common regimen. It is unclear whether lower doses are just as good or whether higher doses are more beneficial. There have been a couple of cases of subdural hematoma or bleeding in the brain that occurred in people taking ginkgo, though it's unclear whether this poses a significant risk. Ginkgo carries the risk of interacting with a variety of medications and other herbal supplements due to its effects on detoxification enzymes. There have been rare reports of seizures in people with epilepsy who supplemented with ginkgo, perhaps due to the stimulation of the enzymatic breakdown of anticonvulsant medication. Number 10. Caffeine. Caffeine is well known for its stimulating effects. A study investigating habitual caffeine consumption during sleep deprivation found that caffeine could mitigate cognitive deficits, improving attention and reaction times in those that were low consumers. And results suggest that heavy caffeine consumers might experience decreased tolerance to sleep deprivation and impaired reaction performance even with acute intake. The long-term effects on cognitive decline remain unclear and require further investigation. Number 11. Panax ginseng. Panax ginseng has a long history of use for various health benefits, including cognitive enhancement. A 2010 Cochrane review found low-quality evidence suggesting potential improvement in cognitive function, behavior, and quality of life. However, due to small sample sizes and limited studies, more rigorous trials are needed to confirm its efficacy. A 2012 RCT of 15 healthy males were given a daily dose of 4,500 milligrams of red Korean ginseng for 2 weeks to assess cognitive performance. There were no clinically significant findings. Side note, it's my pet peeve when studies don't include women. We are half the population after all, so always make sure that when you hear about study outcomes and you are a woman, ask if this applies to you. Run over, moving on. A 2013 review comparison of ginseng and Bacopa against a pharmaceutical nootropic found an improvement in reaction time with ginseng and word recall with Bacopa. However, the number of RCTs is low. Further research studies need to compare directly the differences of these substances in the same cohort and should directly compare the cognitive effects of these agents in direct head-to-head clinical trials. A 2016 meta-analysis of over 250 individuals with Alzheimer's disease showed promising but inconclusive results due to small sample sizes, wide variation in dose of ginseng administered, and relatively poor methodology. There is insufficient evidence to support the use of ginseng in people with Alzheimer's disease, although no serious adverse effects were reported. The systematic review that assessed the safety of ginseng use in humans reported a low incidence of harm, with side effects that were mostly related to gastrointestinal symptoms, such as diarrhea, nausea, vomiting, and cramps. However, high doses and long-term use may lead to development of the so-called ginseng abuse syndrome, which is characterized by symptoms of hypertension, nervousness, sleeplessness, diarrhea, and skin eruptions for people taking 3 grams per day. Higher doses, such as 15 grams per day or more, have also been associated with depersonalization, confusion, and depression. Ginseng might interact with many medications. For example, it might increase the risk of hypoglycemia if taken with anti-diabetic medications. It might increase the adverse effects if taken with stimulants and reduce the effectiveness of immunosuppressants. Number 12, guarana. Guarana is a plant high in caffeine and has garnered attention for its potential cognitive benefits. A 2023 systematic review revealed that guarana improved response times but emphasized the effects were likely due to its caffeine content. Further research is needed to compare its cognitive performance effects against caffeine directly. Number 13, soy isoflavones. Soy isoflavones are phytoestrogens that bind to estrogen receptors in the brain and have been linked to cognitive improvements. A 2020 systematic review of over 1,000 individuals, average age 60 and predominantly Western, highlighted positive effects on overall cognitive function. More research is crucial to generalize findings to broader populations. The dose of soy isoflavones range from 60 to 160 milligrams per day, with a median duration of intervention was 17 weeks, with no severe adverse effects observed. Number 14, CDP-choline. CDP-choline or acetylcholine supports the production of key neurotransmitters involved in memory and attention. A 2005 Cochrane review of older adults with either mild cognitive impairment or dementia found a small effect on memory after supplementation. Most of the included studies administered CDP-choline intravenously or intramuscularly, and so the results might not be generalizable to oral supplementation. A 2021 RCT of 100 healthy men and women aged between 50 and 85 with age-associated memory impairment using 500 milligrams of acetylcholine daily for 12 weeks improved overall memory performance, especially episodic memory. The findings suggest that regular consumption of acetylcholine may be safe. The study is limited to predominantly Caucasian populations. Future studies in wider ethnicities and for longer durations are needed for more generalizable outcomes, and to determine if beneficial effects last after cessation of supplementation. Number 15, and lucky last, astaxanthin. Astaxanthin is a red pigment found in various seafoods. It seems to reduce markers of oxidative stress, though it's unclear how potent it is and to what extent this translates to health benefits. It could possibly reduce oxidation of LDL cholesterol and DNA damage by making it potentially good for cardiovascular health and anti-aging. It also may improve photoprotection and overall skin health, but more research is needed. A 2024 systematic review of 11 RCTs with over 300 individuals for 8 to 12 weeks did not show benefit for cognition, but it may have some benefit for physical fatigue. In conclusion, while some cognitive supplements show potential, the evidence is mixed. and there is no one-size-fits-all solution. It's crucial to approach supplementation with caution and consult a healthcare professional, especially if you're pregnant, breastfeeding, if you have an underlying medical condition, or are taking medications. So what do you think about cognitive supplements? Have you tried any? Share your thoughts in the comments below. Don't forget to like, subscribe for more insightful content. Thanks for watching. Come walk the talk with the doc, and I'll see you in the next video.